project, we're going to be focusing on articular cartilage replacement device for arthritis in the metacarpal phalangeal joint. My name is Alexandra Zamora.
I'm Jocelyn Kurtz.
I'm Karen McEvoy.
And I'm Lindsay Schneider.
So we're going to start with the clinical significance for this project. In a study conducted in 2005, it was found that 1.5 million Americans suffered from arthritis. The disease is associated with extreme functional loss and a shorter lifespan. The disease will attack the joints of the fingers by wearing down on the cartilage between the bones, which results in pain with movement. If the disease is left untreated for long enough, it will completely wear down the cartilage in between the bones, which will later result in bone damage. The current treatment for this disease is anti-inflammatory medication, which minimizes the pain and halts the disease progression, but it does not provide a solution for joints that are already damaged. This becomes a problem because patients are relying on this medication to keep the pain at bay, rather than replacing the cartilage in the joint and actually fixing the problem. For patients with severe joint damage, there are two options for surgery. There is fusion of the joint, which is shown on the right-hand picture, and this is meant for smaller joints like the proximal interphalangeal joint in the finger. And this procedure involves fusing the two bones together, which eliminates the pain, but also eliminates movement in this joint. There's also replacement of the joint, which is meant for larger joints in the hand like the metacarpal phalangeal joint, and this procedure involves completely replacing the joint with an artificial one, which does restore mobility. However, these procedures are meant more for patients that already have severe joint damage in terms of bone damage, so there currently is not an option for patients in earlier stages of the disease that do not have this bone damage yet. So we're looking into making an articular cartilage replacement.
So we're going to be targeting those patients with early to intermediate stages of arthritis who have damage to their articular cartilage rather than the extreme bone damage that Alex was referring to. We're also looking at the metacarpal phalangeal joint shown in the picture on the left, which is a synovial condylar joint and moves biaxially, so we'd like our device to be able to move in this way too. Our idea is to put a piece in between the two bones where the damage to the articular cartilage has occurred, and it would be flexible and allow for movement, be durable and strong enough to handle the wear within the joint. It would be 1 to 5 millimeters in thickness and hopefully closely match the modulus of articular cartilage, which is about 0.8 megapascals. We're looking at electrospinning a mesh piece out of silk or ultra-high molecular weight polyethylene, and also looking at PBMS or a permanent hydrogel that would be cross-linked and expand in the wet conditions of the body to securely be put in place in between the two bones in that joint.
Next, we're going to go over the benefits and costs associated with our device. To begin, some benefits we see are that it's going to restore functional mobility to the site of the joint. Instead of covering up the problem, it's going to fix it, which is different than other treatments right now. Some costs that we see associated with this device are that it's not going to work for all arthritis patients because it's only going to work when the cartilage is damaged and not the joint. Additionally, putting in the device and it degrading over time causes inflammation. Inflammation is one of the major causes of cartilage degradation, so we want this device to have appropriate material that limits inflammation because a con of our device is that the inflammation would cause further cartilage damage.
Currently, the state-of-the-art treatments for arthritis of the hand are joint replacements, such as the pyrocarbon joint by Integra or the silicone joint by Swanson. There's also research into other therapies, such as joint distraction and its benefits in cartilage regeneration, and anti-cytokine therapy, which soothes inflammation and slows the progression of the disease. This leaves an opening for an implantable medical device implanted in the early stages of arthritis, which will stop the progression of the disease and allow the patient to lead a long, pain-free, mobile life without a need for a major surgery.
And that's it. Thanks for watching.